One last point I want to make about the IOM studies in vitamin D. They did not discern a difference between vitamin D2 or vitamin D3, which brings us to the next topic, toxicity. There is a widely held belief that vitamin D, being a fat-soluble vitamin, can be toxic at doses beyond the RDA of 800 IU, or certainly beyond the UL of 4000 IU. We've already discussed some good reasons to question the validity of the RDA and UL values, but yet another reason is that part of their determinations were based on some very old and tainted studies which were done on vitamin D2, not vitamin D3. They make the incorrect assumption of vitamin D2 and D3 dose equivalency, which is a glaring flaw in their studies. The truth is that vitamin D2 and D3 require different dosages to be effective and also have different bioactivity. In a recent study published in Nutrients, January 2018, researchers compared how vitamin D status was improved in a group given a daily supplementation of vitamin D2 versus a group given a daily supplementation of vitamin D3. If vitamin D2 and D3 were truly dose equivalent, then similar vitamin D status improvements would have been observed in both groups. However, that was not the case. In fact, the researchers found that vitamin D2 was significantly less effective in improving vitamin D status than vitamin D3 was. Other studies have concluded that vitamin D3 is twice as effective than vitamin D2. Not only that, other studies have shown vitamin D2 to be far less effective than vitamin D3 is in promoting calcium absorption, because the metabolites produced from vitamin D2 do not bind nearly as well to vitamin D binding proteins as the vitamin D3 metabolites do. It was initially thought that both vitamin D2 and vitamin D3 followed the same metabolic pathway. However, minor differences in the chemistry of side chains result in differences in the site of hydroxylations, the subsequent hydroxylations to the formation of calcitriol, which leads to the production of other unique biologically active metabolites. According to Dr. John Canal, MD, from the Vitamin D Council, fear of vitamin D toxicity, also known as VDT, vitamin D intoxication, or hypervitaminosis D, is unwarranted. And such unwarranted fear, bordering on hysteria, is rampant in the medical profession. This sentiment is supported by Dr. Reinhold Weiss, who in 1999 asked the medical community to produce any evidence that 10,000 units of vitamin D a day was toxic, saying, "Throughout my preparation of this review, I was amazed at the lack of evidence supporting statements about toxicity in moderate doses of vitamin D." He added, "If there is published evidence of toxicity in adults from an intake of 250 micrograms, that's 10,000 IUs, per day, and that is verified by the 25 OHD concentration, I have yet to find it." Weiss reports human toxicity probably begins to occur after chronic daily consumption of approximately 40,000 IU per day. According to Dr. Michael Hollick, PhD, MD, who published an article for the Mayo Clinic in May of 2015 titled "Vitamin D is not as toxic as was once thought," the evidence is clear that vitamin D toxicity is one of the rarest medical conditions and is typically due to intentional or inadvertent intake of extremely high doses of vitamin D, usually in the range of over 50,000 to 100,000 IUs per day for months to years. Tons of other more recent well-designed studies of vitamin D3 have determined that 5,000 IUs per day is safe, and for those with greater needs, doses far higher can be taken without any risk. For the sake of completeness, it's important to say that the main consequence of vitamin D toxicity is a buildup of calcium in the blood called hypercalcemia. Early symptoms of hypercalcemia include nausea, vomiting, diarrhea, constipation, and weakness. Excessive thirst, an altered level of consciousness, high blood pressure, calcification in the kidney tubes, kidney failure, or hearing loss may also develop. Hypercalcemia caused by regularly taking high amounts of vitamin D supplements may take a few months to resolve because vitamin D accumulates in the body fat and is released in the blood slowly. Treating vitamin D intoxication includes avoiding sun exposure and eliminating all dietary and supplemental vitamin D. Doctors may correct calcium levels with increased salt and fluids by an intravenous saline. The bottom line is that vitamin D toxicity is exceptionally rare, and when it does occur, it is much more likely to relate to supplementation with vitamin D2, not vitamin D3. Most people can take vitamin D supplements with no problems. However, it is contraindicated in a few situations. If you're taking digoxin for an irregular heartbeat or thiazide diuretics for high blood pressure, you should not take high doses of vitamin D. If you have primary hyperparathyroidism, Hodgkin's or non-Hodgkin's lymphoma, a granulomatous disease, kidney stones, some types of kidney, liver, or hormonal disease, you should consult with your healthcare provider before taking vitamin D. If you have high blood calcium levels, you should not take vitamin D without consulting with your healthcare provider. We've already spoken about vitamin D2 and D3, and here's a summary of the practical differences between them. Vitamin D2 can only be prescribed by a doctor and really should be avoided. Conversely, no prescription is needed for vitamin D3, and it is safer and more effective than vitamin D2. Vitamin D3 can be derived from lanolin, from wool-bearing animals like sheep, which is then purified and crystallized to produce 7-dehydrocholesterol, which is then exposed to ultraviolet radiation to produce vitamin D3. Vitamin D3 can also be derived from fish liver oil. People often want to know which source of vitamin D3 is better, lanolin or fish oil. According to Dr. John Canal, MD, they are the same. Our bodies cannot tell the difference between them. Cholecalciferol is cholecalciferol. NHS Global has been producing D-Max, our vitamin D3 product, since 2003. D-Max is a 5,000 IU vitamin D3 product derived from lanolin and comes in a 250 count bottle. D-Max was formulated to be the perfect one-to-one complement to VK2. That's NHS Global's vitamin K2 product. D-Max can be taken by itself, but it's recommended to take 1 capsule of D-Max for each capsule of VK2. They should be taken together at the same time. Well, that concludes our presentation. Thanks for taking the time to watch. For additional information, please visit vitamin-d-max.com or call toll-free 877-965-2140.